Hi students, myself Abhida Matthew. Last class we discussed about the NICU. Now we are going to discuss about the topic instrument and facilities in NICU. Apex institution or regional perinatal center must be equipped with the centralization supply, suction facilities, incubators that is open care system, vital signs, monitors, transcutaneous ventilators and infusion pump, which are mandatory to provide intensive neonatal care. This is the usually equipments used in the NICU. You can see from this picture, this is the crash trolley, this infusion pumps, suction, oxygen supply, ventilators. Okay, this is the normal setup of NICU. We can see the setup in equipments used and facilities. First is a physical facility: location, space, floor plan, ventilation, lighting, environmental temperature and humidity, and acoustic characteristics. Each one we can see in detail. Handling and social contacts, communication system, electrical outlets also must be there. First is physical facilities. The neonatologist and the nurse in charge must be involved while planning the unit. So while planning the neonatal intensive care unit, who all must be there? That is, the neonatal must be there. A nurse in charge of NICU must be there while planning the facilities of NICU. The intensive care area should be localized, preferably next labor room ward and labor delivery room. So it should be located near to the labor ward or delivery room. For economizing the cost, it would be preferably to it combined with the level 2 facilities. And though both the areas there must have separate adequate staff and single administrative control. So for the NICU there should be separate and adequate staff must be there and a single administrative control for the NICU. Next, temperature of the unit. The location. The NICU should not be located on the top floor, but there must be adequate sunlight for illumination. The unit must have a fair degree of ventilation of fresh air through central air conditioning is a must. And the temperature inside the unit should be maintained at 28 degree plus or minus 2 degrees Celsius, while the humidity must be above 50%. So this is the location is never be at the top of the floor, but the walls if it open or the light source must be come from the outside. So that's why the walls any two of the walls must be in the outside area. So that is the area of the NICU location, and the temperature is 28 degree or 1 plus or minus 2 degrees Celsius must be maintained, and humidity must be 50% or above. Okay, that is the location and the temperature. Next is shifting. How we can shift in case the unit is responsible for picking up babies. So this unit must be responsible for taking or picking up the babies from particular area and referred from the regional hospital. It should be within easy access for the ambulance entrance and should have a separate elevator. So this NICU, the entrance must be for the easy access of the ambulance entrance. So ambulance can be to reach the easily to the NICU nearby. Then there should be a separate that is a lift. That is a elevator. That means lift. There should be separate lift for to go to NICU. And if the baby is sick in the operation theater after the surgery, after the cesarean, or after the delivery if baby is serious, the NICU staff must be responsible to reach there and pick the baby. Then physical setup or size. The NICU can be in a single area or it can be multiple rooms with a capacity of 2 to 4 infant each. Okay. Then bed strength of NICU. One intensive care bed is generally required for 100 deliveries provided a prematurity ratio is around 8% and hence for the population of 1 million people. So if the 100 deliveries are occurring in the hospital per month, so that is one intensive care unit bed is generally required. Okay, so no 30 intensive care bed would be required for one country, and the supportive services to be provided for it would be uneconomical to have a NICU of less than 4 to 8 bed. So there should be around 8 bed NICU must be the for the and the 30 intensive care bed should be required for the for a country. Then aspects of NICU. The two main important aspects in NICU are physical setup and administrative setup. So categories of NICU, there are 3 categories are there. That is according to the level, it is classified into first level, that is mild, second level moderate, and third level is critical. So level first, that is level of neonatal care, level 1 care, that is the minimal care is required in such NICU, that is provided by the mother under the supervision of basic health professionals like phototherapy needs. So that is not much needed for the NICU staff to maintain the. So the mother can be stand nearby the baby while providing the phototherapy. That is a first level care. The neonate weighing more than 2000 gram or having gestational age maturity of 37 weeks or more belong to this care. So usually this mild or minimal level care is usually given in the baby, such as the weight of the baby must be more than 2 kg and maturity is more than 37 weeks. And this care can be included care of delivery, includes care of delivery, provision of the warmth and maintenance of asepsis and promotion of breastfeeding. This only included in the first level care or minimal care. Second is second level care. This this care include requirement for resuscitation, maintenance of thermoneutral temperature, the intravenous infusion, gavage feeding, phototherapy and exchange transfusion must be there in the second level neonatal care unit. That 10 to 15% of newborn require this care, and this care is anticipated for the infants weighing in between 1500 to 1800 gram. So first level we already told it is more than 2 kg. So this is 1.8 to 1.5 to 1.8 kg between babies are cared in the second level care, or having the gestation age maturities of 32 to 36 weeks. This is a second level care. And the third level, tertiary third level, severe moderate babies. This care include life-saving supports must be there. Life-saving supports such as ventilator and best suited special intensive neonatal care must be there. 3 to 5% of newborn require the care of such type, that is intensive or ventilator care support. This level of care is for critically ill babies, for those weighing less than 1500 gram or having gestational age maturity of less than 32 weeks. So this tertiary care is 32 weeks. So 32 less than 32 weeks baby and weight is less than 1500 gram. That is the 3 levels. Okay. Next we can see the physical setup. So space between the patient. For the patient care 100 square feet is required. You can see the distance from each bed. So 100 square feet is required for each baby, as it is true for any adult bed also. And there should be a gap of 6 feet between two incubator. If the babies are in incubator, so between two incubator there should be 6 feet distance must be there for adequate circulation and keep the essential life-saving equipments, and space needed about 120 square feet. And each patient station should have 12 to 16 central voltage stabilized electrical outlet must be there. So there should be 12 to 16 central voltage stabilized electrical outlet must be there in each patient station, and 2 to 3 oxygen outlet, 2 compressed air outlet, 2 to 3 suction outlet. Additional power plug point would be required for the possible X-ray machine and close to the patient care area. Portable X-ray machine close to the patient care area. The physical setup. Next, hand washing. Water hand washing. That is, the unit must have an uninterrupted clean water supply, and each patient care area must also have a wash basin with a foot or elbow operated. At the top must be operated with the foot or the elbow. Near wash basin, placing paper towel and receptacles, that is the waste bins. Okay, so there must be the wash basin. Nearby the wash basin there must be paper towel or receptacles. Must be the unit should be equipped with the laminar air flow system, that is the air flow system must be in and out flow system. However, alternative air condition with multi-pore filters and fresh air. Multi-pore filters means mild open filters, that is a fresh air exchange of 12 per hour should be provided. That is about the air flow and the water hand washing system. Next is the color. The wall of the wall unit should be washable and have a white, slightly off-white color for better color appreciation of the neonates. So neonatals, the eyes should not be suffered the bright light. So there should be white or white color or slight white color should be off-white color should be used. Then lighting. The lighting arrangement should provide uniform and shadow illuminations of 100 foot candles or by at the baby's level. And in addition, spot illumination. There should be spotlight. Spot illumination should be available. Each bed there should be spot illumination. It be available for each baby for any procedure. And a generator backup is mandatory where there are frequent power fluctuations, power failures. So if the frequent power problems in that area, there must be a generator backup system must be there. Next is sound. The aquatic means it's a flowing sound. Let's say aquatic. Aqua means the water sound, that is aquatic characteristic should be such that the intensity of noise kept well below 75 decibels. 75 decibels below it always we have to keep the sounds. The unit should also have an intercom and a direct outside telephone line so that the parents of the patient can have easy access to the medical personnel in case of emergency. So for any emergency, the medical person can call to the parents. So for that there should be an intercom and direct outside telephone must be there. Then the rooms. Apart from patient care area, including rooms for the isolation and procedure, there is need of space for certain essential functions like room for scrubbing. Yes, room for scrubbing is for the hand washing and the scrubbing area, and glove near the entrance. So there should be the area where they have to rub their hand and they have to change the gown. That should be located just the entrance of the NICU, and a side laboratory and mother's room, adequate stores for keeping consumable and non-consumable articles must be there, and a room for keeping the X-ray and ultrasonic machine. So what all the rooms must be there? There should be a newborn room, entrance room. There should be a gown area and scrubbed area. There should be a laboratory, mother's room feeding room must be there, and stores must be there. Then a room for keeping the X-ray and ultrasonic machine and ventilators to keep. So these are the main rooms must be there. Then one or two rooms each should be needed for doctors and nurses on duty and night duty. So there should be a doctor's room for the day duty and night duty doctor to take rest. There is space available for biomedical engineer to provide essentially preventive maintenance of the costly equipment. So in between there must be there is biomedical engineer must come and check the equipment for their function. So there should be separate space available to provide the this electrical or engineer biomedical work. Then additional space for will be required for educational activity. There should be a room must be there to give the in service or continuing education and storing or the database. Then ventilation, minimum of 6 air changes. 2 air changes should be outside filtering and inner air. And effective air ventilation of nursery is essential to reduce the nosocomial infection. That's nosocomial means hospital acute infection. For the effective air ventilation should be there in the nursery to reduce the nosocomial infection. The air conditioning ducts must be provided with the millipore filter. Millipore filter means 0.5 Hz to restrict the passage of the microbes. So that is about the ventilation. Then ventilated air, a simple method to achieve satisfactory ventilation, consists of vision of exhaust fan in a reverse direction near the ceiling. Ceiling the reverse direction ആണ് നമുക്ക് ventilation വേണം. Near the ceiling for input of the fresh contaminated air and fixation of other exhaust fan in the conventional manner near there for air exit. So there will be inside that is coming and going direction. There should be 2 exhaust fan must be kept for the ventilation, proper ventilation of air. Then infection control measures, hand washing facility. Each room should have a separate bathing facilities. It can be used for children, and sinks are regularly cleaned by the disinfection. Then administrative set. Till now we did the physical setup. Now we are going to see the administrative setup. So in administrative step, medical staff, the unit should be headed by a director who is full-time neonatologist with a special qualification and training in neonatal medicine. That is the first medical staff, that is neonatologist, is the director, and he should be responsible for maintenance of standard of patient care. So next is the development of operating budget and equipment evaluation and purchase, planning and development of education program, evaluation of effectiveness of perinatal care in the area, and he should devote time to patient care services, research and teaching, as well as coordinate with the level 1, level 2 hospital in the area. Then staff requirement, neonatal physician, that is for the 6 to 12 patient there should be a neonatal physician must be there in the continuing care, intermediate care and intensive care. So there should be a neonatal physician for the 6 to 12 patient in the continuing care, intermediate care and intensive care areas, and he should be available on 24 hours basis for the consultation. He should be available every time, that is 24 hours, and ratio of 1 physician in training to every 4 to 5 patient who require intensive care ideal round the clock. Round means always. There is a ratio 1 physician training for every 4 to 6 patients are needed. That is round the always should be available. Then service of other specialists like microbiologist, hematologist, radiologist and cardiologist also should be available on call. Next, nurses ratio. The nurse-patient ratio is 1:1 maintained throughout the day and always the ratio 1:1 ratio should be maintained. A ratio of 1 nurse for 2 sick babies not required ventilators. If the patient is required ventilator support, there must be 1:1 ratio maintained. If not required ventilator support, then 2:2. That is for the 2 patient 1 nurse ratio can be maintained. Then experience. Staff nurse must have a minimum of 3 years work experience in special neonatal care unit in addition to have 3 months hands-on training in the intensive neonatal care. He should have specialized neonatal care experience and also 3 years work experience must be the neonatal care unit and additional hands-on experience for the 3 months of intensive neonatal care unit. And next, other staff. There is a special need of motivated staff responsible for upkeep and cleanliness of the unit. And special attention must also be made to train and educate other persons their role in the patient's care. So we have to give up to train and educate. There is a training educator with the other persons their roles in the patient care. Then one sweeper should be available round the clock whenever necessary. Always there should be a sweeper for this NICU. Next, laboratory technician, public health nurse or social workers, respiratory therapist, biochemical engineer, ward clerk can help in keeping track of the stores. So there should be a ward clerk. He should keeping track of the stores. So next is the equipments. You can see these all the equipments. I think you can see weighing machine. This is a ventilator, ampoule with the mask. You can see some of the equipments used in the feeding equipments. Okay, so equipments are the resuscitation equipment, bag and mask resuscitator, the oxygen and suction facilities, catheter, syringes and needles. Feeding equipments. Feeding equipment you can see from this. This is the feeding equipment. Laminar flow system. Laminar flow system means here there is a flow of air. Both sides is a laminar flow system. Then weighing machine. And bassinets. It's for keeping the baby. Then incubator. You can see from this picture. Radiant heat warmer. This warmer. Then thermometer. Thermometer is a this is the thermometer is normal. It's an oxygen analyzer. This is the electronic oxygen analyzer. Then oxygen concentrator. Oxygen concentrator. This is then fixed heat shielder. Phototherapy unit. You can see from this picture. And heart rate monitor. You already know. The respiratory rate and apnea monitors. Blood pressure monitors. Multi-channel vital signs monitor. This is a multi-channel vital signs monitor. Then infusion pump. This is a syringe pump. Okay. And bilirubin analyzer. This is the bilirubin analyzer. Then this is the transcutaneous bilirubin analyzer. This is transcutaneous. You can just keep the skin of the baby. So that is transcutaneous bilirubin analyzer. The transcutaneous blood gas monitor. This is the transcutaneous blood gas monitor. Then pulse oximeter. Then capnography or enteral carbon dioxide. The neonatal ventilators you already know. And neonatal pulmonary function test and cranial ultrasonography. And intracranial pressure monitoring. You can see from this picture. This is intracranial pressure monitor. And extracorporeal membrane oxygenator. This is the extracorporeal membrane oxygenator. Then placenta prototypes. These are the main equipments used in the NICU. Equipments for level 3 nursing. There is 6 bed in a NICU. Required things are resuscitation unit, set 6, open care system 4, incubators 2, infusion pump 12 to 6 to 18, positive pressure ventilator 6, and oxygen hood, oxygen analyzer 6, heart rate apnea monitors with 6, with the scope with that is 6, and phototherapy unit is 6. And level 3 nursing, that is 6 bed in other needs, other equipments need, that is electronic weighing machine 1, pulse oximeter 6, end dial CO2 monitor 6, and transcutaneous PO2 and PCO2, that is 2 to 3, and non-invasive BP monitors 1 to 2, invasive BP monitors 1 to 2, ECG monitors and defibrillators is 1, intracranial pressure monitor is 1, and portable radiograph machine is 1, and portable ultrasound machine is 1, and blood gas analyzer. The disposable article required for the NICU are IV catheter, IV sets, microbiologist sets, bacterial filters, feeding tubes, endotracheal tubes, suction catheters, 3-way stop clock, extension tubing, umbilical, arterial and venous catheters, syringes, needles, and trocar and cannula. Trocar and cannula means trocar and cannula for the spinal aspiration, spinal fluid aspiration. Then laboratory facilities as microchemistry laboratory, well equipped to provide quick and reliable, and facilities for creative protein, total leukocyte count, and a microscopy examination of the peripheral blood. Next, documentation in ICU, that is the unit should have printed problem oriented stationery for maintaining records, and admission records, that is admission and discharge slip, etc. And records of all admission should be maintained in a register or on a computer. The information should be analyzed and discussed at least once a month to improve the effectiveness of the NICU in providing the services. This is the floor plan of NICU. You can see the storeroom, conference room. So then this is formula room, formula feeding room. This is doctor's room. This is nurse's room. This is nursing station. This scrub. So when this is the entrance, so there is scrubbed gown, and this is a special care room. So you can go enter to the scrub gown. This is scrubbing area, gowning area. So from there we have to enter the nursing station. Through here, this is special care room. You can go through the veranda. This is the minimal care room. This is the isolation room. So that's a separate rooms. And here is the cleaning area, and fumigation chamber is here. And this is the X-ray room, lab, procedure room, gowning, gowning nursery, and waiting area for the parents. Okay, these are the is a floor plan for the NICU. So that's all about the instrument and facilities in NICU. I think all of you clearly understood. Thank